Good afternoon to all. I think we have to start our workshop. I see that we have less people than registered for the workshop, but I think it's okay. I would just suggest, because we are a small group, if you would like those who are at the last rows just to come forward. Thank you. I think it will be much better. A warm welcome to all of you, and thank you very much for choosing this workshop, which is dedicated to developing and implementing national situational analysis related to early childhood intervention systems and services. My name is Vera Rangelova, and I have the pleasure to moderate the workshop. Before going and presenting our speakers, I wanted to say that we will have two presentations and then and then some time for questions and answers. And at the end of the workshop, we also allocated some time for discussion and for reflection on the presentations. Since we are not a big group, I think I would suggest to keep it as informal as possible. And there is also interpretation in our room for those who really need this. So our workshop is focusing on developing national situational analysis of early childhood intervention and services. We heard in the morning how important is the situational analysis in the process of building strong national early childhood intervention systems. This is a research which gives us reliable and comprehensive data about where we are in our systems, what are the available services for children, which groups of children we serve and reach out, if there are any children that are left out of the process, to what extent the services that are delivered are aligned with the family-centered practice, and also the available evidence related to early childhood intervention. Is there sufficient legislation, also funding? Do we have professionals required for early childhood interventions in the country? So all these questions are addressed through the situational analysis. And I must say the situational analysis is something that we do in the beginning before we start kind of to comprehensively work on building the system. But we also can do this along the process at any moment, just to see where we are, what we need to do for the future, what we need to strengthen or further develop. Our workshop will look a little bit at the methodology for a national situational analysis of ECI, which was developed by the Rice Institute and UNICEF. And I'm really happy that we also have the principal author of the methodology with us, Emily Vargas Baron. And thank you, Emily, for joining the workshop. Also we will look at how this methodology was applied in two countries of our sub-region, in North Macedonia and Montenegro. What were their challenges, lessons learned, and what was the outcomes and way forward after the situational analysis? So let me welcome our speakers. This is our first speaker is Ida Ferdinandi. This is a colleague from UNICEF, Early Childhood Development Officer. For many years, she's been working and supporting the government in Montenegro on different programs, policy reforms related to early childhood development, but also to health, nutrition, child protection, parenting support. And we also have a speaker from North Macedonia, Professor Aleksandra Karovska. She's from the Syrio and Methodio University in Skopje. She's a professor, and she has also a PhD from the Faculty of Psychology at the university. So let me give and pass the floor to Ida, who is going to talk about the implementation of the situational analysis in Montenegro.
Thank you. I have a PowerPoint and I have a clicker. Okay, good. So I'd like to first thank the organizers for inviting me to present the Montenegrin situation analysis on early intervention. I would like to thank you for coming to this session and selecting this session. I'd also like to thank the previous speakers because they really helped me set the stage for this presentation and will enable me to go through some of the slides more quickly. And I just want to say that it's really a pleasure to be part of this conference also as a participant, because these events are, really wonderful and inspiring because they show that even though this approach has been around for 50 years or so, it's still picking up speed in this region, and it's wonderful to be a part of this movement. So it's very, very encouraging for Montenegro to continue on this path. Okay, so so a few slides that I will go through quickly because you've received, a lot of information this morning on, the theory and concepts, but just to go quickly through a couple of slides because they really guided the development of this conceptual framework, and they helped to structure the research and to develop this research instrument. So it's very important to go through a theory of change for early childhood intervention services, which really illustrates how and why we expect positive outcomes to occur thanks to high quality and universally available national early childhood intervention services. So you can see here that at the beginning, we have, pre-existing situations of children that are risk factors such as preterm birth or premature or a small birth weight or poverty, malnutrition, that can result in certain conditions, at-risk situations or developmental delays or disabilities. Then we need to have an organizational framework, a national early childhood intervention system to provide high quality and universally available early childhood intervention services through leadership, planning, coordination, and financing. And that enables us to have, preconditions for providing quality services, which are really the inputs, like service standards, personnel, training, to be able to have these core early childhood intervention services, which are outputs, comprehensive identification, comprehensive assessment, family service plans, home visits, quality assurance, and so on and so forth, which allows us to have these key service outcomes, which is improvement in child development. And finally, that really yields very important benefits to the whole society. Emily showed this morning this slide, or a couple of slides, but this is really just a quick snapshot showing this continuum of legacy, evolving, and contemporary services. So again, just to highlight that, Montenegro and many countries in this region started off with this medical model, and we are now in Montenegro and a few countries in this region in this evolving services pillar, where we have sort of a medical model base to an extent, with defectology approach, individual therapy, one-on-one with the child. But there has been changes, and there's some concepts that are sort of contemporary, but they're being applied as sort of elements. And this is why we have now this mix or evolving services, where we have maybe some screening or some team-based comprehensive developmental assessment, individualist family service plans, some family-centered services, but we're not really fully sort of contemporary services. And the contemporary services, this is the last column is, where we want to be. So as we heard this morning from so many speakers, that are based on the social and child rights model, that is family-centered, transdisciplinary, and where the primary goal is to support the family, the parents, the primary caregivers, to support the child to develop. One more slide as the guiding framework. This one shows the sequence of steps. in usual early childhood intervention service process. So we start off with identifying these children, developmental monitoring and screening. That can be done by pediatricians, but also various personnel workers, community workers, for example, in childcare or preschools. And once these children at risk are identified, then there's a referral to more comprehensive assessment to establish early childhood intervention eligibility. Then we have assessment of families, and this enables us to develop an individualized family service plan, which is a contract that defines the needs, the frequency of visits. The participants are parents, obviously, as well as professionals. Then usually these transdisciplinary teams agree on a primary service provider who then visits the families. Then after these visits, we have periodic reviews of this plan in case goals have been achieved or there's some changes in situation, or after some time to see whether we're on track. And then at the end, we have transition plans for children who are exiting services or they're transitioning to inclusive preschools and schools. So now we can zoom into the situation analysis and the methodological guide for conducting situation analysis. So it's been said also a couple of times already why it is so important to have early childhood intervention situation analysis, and why we have this methodological guide to guide this type of analysis. So I would like to quote Emily Vargas Baron, who said that the fundamental goal is to help countries prepare comprehensive national situation analyses of their ECI systems and services for planning an evidence-based and sustainable national ECI system that will offer effective, high quality, equitable, and accountable services for parents and caregivers of infants and young children with developmental delays and difficulties, initially in the region of Europe and Central Asia. So I couldn't have put it better, so I thought it was better to just use the quote directly. And it's important to say that these situation analyses are not evaluations. And this was a question in Montenegro. Oh, are we going to evaluate this service? Are we going to evaluate? No, we're not evaluating services. We're not qualitatively assessing organizations. You know, we had to tell the participants as well. We're addressing really the status of the national early childhood intervention system, if there's one, to provide descriptions of the components and to provide recommendations on how we can make this organizational framework that was in the middle of that theory of change, so that we can shift to contemporary early childhood intervention services. So there are several questions that you can see. You can see on the slide here. So what the focus is on enabling environments. So what policies, plans, laws, regulations, and standards exist. Then is supply meeting the demand? Are we finding the children with developmental difficulties? Can families find and easily enroll in early intervention? Are we reaching remote, rural, and marginalized groups, for example, Roma families in this region? What models of evidence-based contemporary services are we using in each country? And very important, do ECI systems and services have monitoring evaluation systems? Do they measure outcomes? And here you see the cover page of the methodological guide that was developed in partnership between UNICEF, the RISE Institute, and supported by the European Union within this regional initiative that you see on the slide. This is just to show the research strategies briefly. So it's very important to say, firstly, that this is not a top-down process and it's not an office-based process. It's very participatory. And you can see all these strategies and segments. It's very comprehensive. That first we have a systemic inquiry. We look at literature. We do a mapping study to see, what services exist, which services are early intervention services. Interviews with policymakers, with academia, with key stakeholders. A cost and finance sub-study to look at the funding streams, the government budget and how it works at national level. Then you have this green column here, which is the early childhood intervention service provider inquiry, where we have surveys, mostly to get quantitative data, focus group discussions to get in-depth understanding, and then also one aspect of this cost and finance is sort of lower to the local level, doing a sub-study of some selected service providers to see, how this national budget plays out in practice at ground level, at service level. And then very, very importantly, beneficiary inquiry, where we also have surveys and focus groups discussions with caregivers and parents. This methodological guide was field tested in 3 locations in 2021, 2022, I believe, in these 3 locations. And I'm going to obviously zoom in on Montenegro. And this is the cover page of the situation analysis done in Montenegro. This is an executive summary. I forgot to put the link in the slide, but I will do that before the PowerPoints are uploaded on the conference website, so you can easily find it on our website. This is a research team. They were led by Emily Vargas Baron, and it was really such a pleasure to have her with us. I know she likes Montenegro very much, so we could benefit from that. They did really an excellent job, and I really want to thank them. So I wanted to have this special slide just to really thank them. So in a nutshell, what is the situation in Montenegro? So as you can see, I have 4 boxes because the system pretty much looks like this, unfortunately, quite fragmented in silos. In the education sector, we have inclusive preschool institutions. And in fact, I think we can say that the education sector has really been a champion for many years in inclusion and in social model of disability. Then we also have 3 resource centers that used to be special schools, but they were transformed into resource centers, and they're supporting inclusive education at all levels of education. Then in the health sector, we have primary healthcare centers that have the well baby checkups, and the curative care and all of that. But then in some of these primary healthcare centers, in the largest ones, we have these regional centers or units for children with special needs, where they provide early intervention. And we also have hospitals at the secondary level and 1 at the tertiary level, including a neonatal intensive care unit that provides also services to children who are born prematurely or of small birth weight. Then we have NGOs, including parents associations, and they're funded by different ministries, but mostly the Ministry of Labor and Social Welfare, and they also provide services on project basis. And we have the social and child protection system, and they have the centers of social work that provide assessment and referral. But then we also have almost in every municipality, we have daycare centers for children with disabilities that provide, some services, some treatments, socialization, activities, and so on and so forth. So rather fragmented. But just as Nežana said just before lunch in the panel, we need to model this approach, and we need to start with strengths, and we need to build on strengths. So even this fragmented system, there's strengths. So the first one would be to say that most institutions studied are evolving to become contemporary ECI service providers. So I'm very happy to say that you can see that we're really shifting away from the medical model, most services, and we're evolving to become contemporary. So that's a good place to start. Then all 3 public sectors fund services quite consistently. We can really say that. And I think it really shows that the government of Montenegro really cares about child development and children with disabilities. And it really has been like that for forever. And they really want to identify ways to coordinate with other sectors. So there's definitely a willingness to collaborate. And service professionals, that's really an important strength. And I love working with them. They uniformly expressed great interest in receiving training in contemporary early childhood intervention. And now they're actually piloting, and I'm going to show this at the end, now that we're piloting contemporary early intervention in 2 municipalities, you know, I can witness this huge interest in training. We never have enough spaces for everybody to attend. And also, when it comes to professionals, I also have to say that they're very dedicated, and they're also quite highly trained as well. And the study showed that 84% met their current pre-service training and certification requirements, and they're just very keen to attend training and, you know, to specialize and to pay out of pocket just to be able to learn and develop and grow. So I really have to highlight that as a strength. And now the challenges. So I would say the first challenge is that there's no ECI strategic plan, guidelines and procedures and service standards. So this is one of the key findings of the CITAN and very critical. And we just need to have that to really ensure, as I said before, high quality and universally available system. Then I said just now that it's a very fragmented ECI system, and it's fragmented in all sorts of ways. So leadership in terms of program, but also in terms of budgetary allocations. Then a really great challenge of ours, as the situation analysis showed, is that that there's no universal screening system, and that we are facing a problem of late identification of children with developmental delays and disabilities. And there's an estimate conducted as part of the situation analysis that between 10% and 15% of children 0 to 6 would require ECI services annually, and that only between 1/3 and half of these children have been identified and served. So this is just one illustration of this need to have safeguards and mechanisms to identify children. And, you know, specialists use neonatal screening tools, and pediatricians use, you know, a screening, but it's really it would only detect maybe some more severe disabilities and congenital conditions, but children with mild disabilities or behavioral conditions, for example, autism, they would only be detected at a later stage, and we need to really find them early. And just to again illustrate this, for example, when this survey of service providers of managers was done, we could see that only less than half, 49%, but just under half of children being served through ECI were below 3 years of age. So a slight majority was older children, and we really want to reach these young ones. There's substantial disparities and underserved communities, in Montenegro are Roma and Egyptian communities, and children in rural and remote areas, and Albanian communities due to the language barrier. And I would say for really Roma, they just remain underserved with respect to health and nutrition and sanitation, all kinds of services. And I think it's similar in countries in the region. Then when it comes to quality issues, there's actually quite a lot to be said here. So as I said, most of our services are evolving to become contemporary ECI services, but very few of them offer home visits, and they're really by and large center-based. Yes, our preschools are inclusive and we have these daycare centers, but we really need to train people and to encourage home visits. Then very few service providers develop individualized family service plans and transition plans. And when they do, sometimes they do, but parental participation is very low. And that shouldn't be like that. This is a plan for them. Then when it comes to training, that a lot of training, and just spoke with my colleague, Aleksandra, who will speak after me, that there's still so much even demand for like specific disability-specific training. And a lot of training that has been provided so far has been disability specific, and it's really sounds like medical model. And then caseloads really are very heavy because there's no normative standards, and that's really causing burnout and drain our professionals. Accountability, that's the last word, but it's so important that, you know, a lot of our monitoring is really for the purposes of administration and financing, rather than measuring outcomes and using for planning programs or planning policy. So really it's mostly to justify payment of the health insurance fund, or so this is really this culture of accountability is a challenge. And when it comes to financing, the system is fragmented, so it is fragmented. Then there's no tagging in the budget, so it's difficult to easily calculate how much really exactly in total is being spent on early intervention. A lot of funds are actually, they leave the country because children are sent abroad for treatment. And we think that these funds should be better invested in building a Montenegrin early intervention system so that families can stay in Montenegro, because it often happens that one parent goes with the child to another country for treatment and the other parent and other siblings remain in Montenegro, and it's a huge financial burden on the families, and some families break down, and it's really very challenging for the families. Now I'm going to present you the recommendations of the situation analysis. So yes, to establish an integrated and multi-sectoral ECI coordination system, including budgetary, would be very important. And budgetary could be to have, this is maybe more challenging, to have an integrated budgeting process, or to maintain it sector-based, but then to develop some interagency agreements to make sure that there's still a joint planning process. Then one of the priorities is also to develop an ECI strategic plan, guidelines and procedures and service standards. A document that presents all the core concepts, eligibility, regulations, methods, guidance, everything that we've seen so far, to be a national document, so that we know, everybody knows in Montenegro that this is, the vision and the way to move forward. Then we need to develop a universal system for developmental monitoring and screening, so that we can address all these challenges and find these children as early as we can. Then we need to shift to equitable family-centered early childhood intervention services. And we need to promote the active participation of families in decision-making to really help them set the goals for the child, to support families to attain their goals, and to provide psychological support. We need to develop integrated pre- and in-service ECI training programs, and to demonstrate in some sites, pilot sites, which is what we're doing right now. And also to, preschool and in-service, pre-service and in-service ECI training programs is very important. And this is why I'm very happy that my colleague who will speak next comes from academia, because we need to do more of this in Montenegro for sure. And to develop an ECI database for monitoring and evaluation and accountability to address this problem, to have a culture of accountability. And finally, to plan and conduct campaigns for ECI advocacy at all levels, parliament, government, local governments, but also social communications, because even though Montenegro has done a lot on campaigning for the rights of children with disabilities, parents are still struggling, and we constantly meet parents who tell us that they did not seek help even when they felt that something was wrong, because they didn't have support of their closest family members, let alone society. So it's something that continuously needs to be worked on. And going forward, so we had this wonderful situation analysis. So what did we do with it? We had a wonderful conference just like this one in November last year. So maybe some of you were there. I know that Emily was. She presented this CITAN. And, we did this to really build consensus of our decision makers and practitioners on the need to shift towards contemporary early intervention. But we also invited colleagues and policymakers and practitioners from other countries, because just like I said at the beginning of my presentation, it's so empowering to know that we're not alone, and that this is, a movement, and that, we're just part of a movement, and we need to jump on that train and really move in that direction. So after the conference, the government of Montenegro, under the leadership of the Ministry of Health, started developing the first national ECD strategy. It was under public discussion when I developed this PowerPoint, but the public discussion is over, and I expect this document to be adopted soon. And it's not a separate ECI action plan, which I would like to see, but it does have some really important messages and even measures to start setting up an ECI organizational framework. And so that makes me very happy, because once this document is adopted, it will be, government vision. And, from there on, we can maybe develop some short-term action plans, but it gives enough to start, to really start this process. Then we started with 2 pilot municipalities as demonstration sites. And we have been providing, this is Kotor and Bilo Polje. We have been providing a lot of training. We have been working with BPC, Belgrade Psychological Association, and Yearly Aid, but also in Montenegro with the Association of Psychologists, Association of Speech Therapists, and Association of Physiotherapists, and providing this training on child developmental monitoring and screening and routine-based family-centered early childhood intervention services. Here we have a picture from one of the training events, which, as I said, there's not enough room for everybody who is interested to participate, and I'm very happy to see that there's so much interest in this. But it's going really well, and I really hope that building on these demonstration sites and our learning, we can develop really our model, which takes into account our specificities and challenges and strengths, and scale it up in the country in the future. Lastly, because the UNICEF representative this morning mentioned Bebo, and I was happy to see that the screens in the corridors have Bebo adverts. This is a very important tool that we also have in Montenegro, along with other countries in this region, to really promote child development. And I was very happy to see in the dashboard that we have that the articles and the features about monitoring child development are extremely popular among parents. Parents really care, and they want their children to develop to their full potential. And this is a very good awareness raising on early childhood development. And just to end, I would like to say that when during the situation analysis, I was so eager to see the results, and I asked Emily, so what is like the key finding, and even asked her to prepare a short draft, because I want to start advocacy before the report was done. And she said that one thing that was striking for her is that Montenegro is such a small country. We have 600,000 people, so small and so fragmented, very unusual. Yes, that's really true. But I mentioned to you how many people, 3 ministries are involved, with the strategy, with the pilot, and 3 professional associations. I think that we can overcome this. And UNICEF now has the slogan, UNICEF for every child. And previously it used to be very nice. I liked it very much, Unite for Children. And I know that Montenegro will unite for children. And next time, I hope we'll have many more successes to share. Thank you.
Thank you, Ida. Now we have 5 questions, 5 minutes for quick questions and reflection to Ida, and then we will have also more time for discussion towards the end of the session.
Hello, thank you very much for the presentation. So I have some technical, mostly questions, like, for example, how long did it take to complete this situation analysis? Maybe an estimation of the cost, if it is possible. I don't know if it is. And how long, according to the action plan that you have made, do you think that the recommendations could take, how long for a comprehensive ECI system to be developed according to the findings of these reports? Thank you.
Thank you so much. How long did it take? Well, maybe I would say it took maybe about a year, but we had challenges because we were in the middle of COVID when we started, and as you could see, it's very comprehensive. There's one thing I forgot to say. We also had a national reference group that was consisted of ministries, various ministries and representatives of various institutions, because we wanted to involve them from the beginning, because this is really not only a situation analysis, it's not only research, but it's really a process of consensus building and capacity building. I think that, maybe it doesn't matter how long it takes, as long as it's done in a participatory manner and that it's actionable at the end of the process. For the action plans, how long will it take? Emily Vargas Baron said in the report that Montenegro can do it in 5 years. If I recall well, this is what she wrote. And I think with commitment and, we heard from other speakers and, from Portugal, for example, that how important these champions are. And, it sounds so banal when people ask you, well, how did you do it? And it's so simple, it's so banal, it's a champion, but without champions, it's very hard. And I think we have champions in the government. And we have, as I said before, I'm sorry to be so biased, I like practitioners. We have champions among practitioners. And because I work with them the most and I really enjoy working with them. And I think that we can do it in 5 years. I hope that the stars remain aligned and that we can do this. Yes, thank you. Thank you very much.
Thank you. Do we have other questions?
Do you have headsets?
Faleminderit. Është në gjithë organizatorët e këtij takimit. Unë jam Gjovallini, kryetari i Partisë për Sonën më të kufizuar gjithë Shqipërisë. Kisha 2 pyetje. Pika parë. Si funksionon kontrollshmëria ndaj shoqatave në shtetet europiane? Para, dhe dyta, si e mendon organizata juaj përfaqësimin politik, sidomos në këshillat bashkiake dhe në parlament të persona më të kufizuar? Dhe sa jeni të njohur, të informuar mbi standardet e jetesës gjithë përfshirës të persona më të kufizuar në Shqipëri? Faleminderit.
I think either maybe we can address the questions to Montenegro, but I just wanted to highlight that because we are talking here about very young children, 0 to 6, 7, the key is the participation of parents and involvement of parents in everything we do. And I think in this situational analysis, the parents were also, we asked the parents for their opinion. So maybe this answers to some extent for your questions for the participations of people with disabilities, because in this young age, the parents and the family are the key people. And maybe, yeah, I don't know if we can talk about the inclusive living conditions in Albania, because it's, we are not from Albania. The colleagues can talk on for Montenegro and North Macedonia. So maybe we can address this question to the people and the participants from Albania. We have organizations also attending the conference. So if we correctly understood the questions from the translation. Yeah.
Maybe I would just add for Montenegro that Montenegro has embarked on reforming the disability determination system that is used for providing cash benefits and services for people with disabilities in Montenegro and families of children with disabilities. And this is extremely important because we know that, and it was actually, in fact, mentioned this morning that, a lot of parents maybe have to leave their jobs because they need to take care of a child with disability. And we really need to have, a good system to support families. So early intervention needs to be situated in this context of various kinds of support for the family. So that's very important. And Montenegro has all kinds of benefits and cash benefits and services, but there are also lots of challenges, and the government is now working on reforming this. And, we really hope that, this process of moving towards contemporary early intervention and improving the conditions of people with disabilities and families of children with disabilities, will go hand in hand, because this is what we need to really achieve the best results and support to families.
Hi, I'm Miguel from Portugal. I didn't get exactly the funding system. How do you propose to be funded? I understood that it started from the health ministry. It is really interesting because it was one of the last ministries to join this journey. And I wonder if it's a different funding system that we have. So it's a service that it's free for all families, and if the budget comes from the health ministry to the whole teams, what kind of budgetary system you propose, and what you think would work best?
Thank you. Very difficult questions. So the easy one first. Well, as I said during my presentation, the Ministry of Education really was the champion, for inclusion in Montenegro, and it's been like this for let's say 2 decades or so. And the Ministry of Labor and Social Welfare had a reform of the social welfare and child protection system, especially with a focus on deinstitutionalization, and a lot of children with disabilities reside in institutions. They really supported the replication of these daycare centers across the country. And maybe I think it would also be fair to say that the Ministry of Health was last to join in Montenegro. But now we have very, very strong leadership of the Ministry of Health, and I'm very happy to see that. Because the Ministry of Health and the health services they reach children at the earliest age. That's the first point of contact with the system when a child is born and in pregnancy. And, we have home visiting nurses, we have, all these wonderful platforms and pediatricians that, universal, all mothers give birth in hospitals, 99%. And so this is really important for us to have them on board. When it comes to funding, well, as I said, the situation analysis showed, and it's still the case, that it's fragmented, but now we're piloting this approach in 2 municipalities. And so far, the 3 ministries are still holding on to their budgets, and we're providing training with the support from the European Union, but the services are using their staff time to do this pilot. So they're trying to accommodate, it's not easy. They're trying to, every change is difficult. They're trying to accommodate, so we're still keeping the structure as it is. But there are ways, and it was suggested in the situation analysis, that we can explore different ways to see. And, I've been looking into Portugal very closely, because it's a good, it's one way to deal with it. And what Serbia is doing, for example, we're learning a lot from them. That, if we keep these sectoral budgets, that at least there has to be more coordination and transparency and tagging and agreements and protocols. We even initiated the signing of a protocol at the national level between the 3 ministries, and then to have local level protocols, because, it has to be set in paper, and we need to support these practitioners in the end to be able to do their job. So, or to have one single budget for this, that's the most challenging way to do it because it involves a huge change in the way things are done now, legislation and all of that. So I assume that the ministry will decide to do a sectoral approach first, and then we'll see if we can move forward. But it's also important to say that Montenegro is a very small country and very centralized, our local self-governments are involved to the extent of their possibilities, but their budgets are very small because the fiscal system is quite centralized. So there are also some differences between Montenegro and other countries in the sense that we're small and we have to, maybe develop our own model. So we'll see. Thank you.
Thank you a lot. I would like to suggest to go with the second presentation so that we also have some time at the end for questions and answers related to the experience of conducting situation analysis in North Macedonia.
Thank you, Vera. Good afternoon, everybody. I wanted to start this presentation by thanking you all for coming in such a large number. Unfortunately, there is a smaller part of you here, but thank you for having the stamina to sit here until the end and listen to this last presentation. So my name, as it was mentioned at the beginning, is Aleksandra Karovska. I am an associate professor at the Department of Special Education and Rehabilitation on the Faculty of Philosophy, St. Cyril and Methodius University. I don't hold a degree in psychology. I would love to hold such a degree so that I can read people better. I do have a degree and PhD in special education, and that is one of the reasons that we as the Faculty of Philosophy were contracted by UNICEF to conduct this analysis. This is not my presentation. If it's possible, should I just click and then it's the same? Oh, sorry, yes, okay. So in December 2021, the Faculty of Philosophy was contracted to conduct this national situation analysis. I was the national coordinator of a team of 11 people. 9 of them were professors at the Faculty of Philosophy, not professors only in special education, rehabilitation, but professors in ECI. We had professors from the Department of Social Work and Social Policy and from the Department of Family Studies. We also included 2 practitioners that worked in state-funded centers because we wanted the practitioners inside and their experiences within to help us with our national situational analysis. We had the pleasure and to work with 3 international consultants from the Rice Institute from Washington, D.C. We had the pleasure to work and to learn from Emily Vargas Baron, Kristen Deal, and the international consultant from Georgia. Her name was Natalia Kakabatse, and she helped us with the cost-benefit analysis. So it's very difficult to follow up, to speak after Ida. It was a wonderful presentation. Congratulations. And we're lagging a little bit behind Montenegro. I hope that we can catch up with you. You have done so much in the past month, so congratulations. I was there when you had the presentation for the situational analysis, and you've done so much. I hope that we can follow your steps. So let me just go straight to the point. I've been working at the Department of Philosophy on my Faculty of Philosophy and Department of Special Education since 2006. And, I've passed through all those phases, demonstrator, as we call it, and teaching assistant, assistant professor, associate professor. And literally hundreds of manuscripts have passed through my hands. This methodological guide that was developed by Emily and by Crystal is one of the best combination or triangulation of methodology that I've seen, and I'm very confident to say that it has enabled us as a country, and I believe it's the same with Montenegro, to have a comprehensive overview. Slowly, yeah, I can try. I won't succeed though. And Emily, this morning, I believe, mentioned the word symphony, and this methodological guide is literally like a symphony. We have triangulation of data, so we have qualitative and quantitative methodology. We had triangulation of researchers and triangulation of research instruments. So it was very easy to work when you have this methodological guide in front of you. We knew exactly which questions to ask. And then of course, they helped us with the analysis and the writing of the paper. So thank you, Emily. It was an honor to work with you and to get to know you. So we started the mapping study and the desktop research in January 2022. And for a small country, we're a bit larger than Montenegro. We are a country of 2 million people. We found that we have 55 centers, ECI centers. Now you would say, wow, that's a very large number, but I have to remind you, I have to tell you that these ECI centers, maybe the centers is not a very good name, maybe the better name would be ECI programs. They were small chunks of services of centers, let's say, that provide services for children with developmental delay or disability from birth to 6. Then parallelly with the mapping, we did the desktop research as well. From March to May 2022, we conducted questionnaires for ECI directors. From 55 ECI centers, we got replies from 44. And with that, we passed the thresholds that we had to pass this threshold so that we have a statistical significance in our research. And I have to say that 9 of the 11 directors that didn't participate came from state-funded centers. It wasn't, they didn't participate not because of lack of interest or lack of will to cooperate. They did not participate because of lack of information. As I said, these ECI centers are very small chunks, very small parts of large hospitals or large clinics or large centers for special education. When I say large, I mean large for Macedonian terms, not for larger countries. So a large number of departments are within these clinics. So we got, as I said, 44 questionnaires back. We had 67 ECI staff questionnaires back, and we had 99 beneficiaries, so parents and caretakers, caregivers of children with developmental delays and or disabilities. From April to May 2022, we conducted the qualitative part of the research. So we had 6 focus groups with ECI staff. Each of them consisted from 6 to 8 ECI professionals. So we had speech therapists, special educators, psychologists, social workers, the whole thing. And then we had 7 focus groups with beneficiaries. Each of them consisted from 6 to 10 people. We also worked a little bit post-COVID, so it was difficult to get them all with physical presence, and we had hybrid focus groups. One of the, I think, for me, the best part of the research was the high-level interviews, because I conducted them. And what you said, this is not only a methodological guide with which we can get information. This is a way to raise awareness and to lobby for ECI. And I believe that the best way that we in Macedonia did this was through these high-level interviews. So we had conversations with ministers, not people within ministries, but ministers, and then so from the Ministry of Labor and Social Policy, Ministry of Education, and Ministry of Health. We had municipality leaders, urban and rural, so different types of professionals that could give us their insight, their experience, and their recommendations. From June to July 2022, we conducted a cost-benefit sub-study, and you will see the results later. So which were the research objectives? I will go very fast through these because Zita mentioned a lot of them. At first, it was very important for us to gather data for existing ECI services. We wanted to know who is providing ECI, which types of professionals, and what are they working, who is doing the screening, who is doing the comprehensive assessment, and so on. Then we did the analysis of the current legislation. We didn't have a lot of work, to be honest, because in Macedonia, the only place where ECI was mentioned, and not with that terminology, was the law for healthcare. So we hope that that situation will change in the future as well. Of course, we did analysis of other countries, learned from their experience, and so on. We did an analysis of the status and needs of children in rural and urban areas, because as it was mentioned many times before, and Nida mentioned it, ECI should be affordable and available for all. That's the final goal. And unfortunately, we'll see in Macedonia that we have a lot of underserved children in rural areas, especially. Then we did an analysis of the existing financing capacities. We did identification of ECI staff and ECI training. As Emily mentioned before, and I think somebody from Portugal mentioned it, one of the biggest difficulties is how to train ECI professionals, pre-service and in-service. What can we do about that? So we were interested in the current situation and how to improve it. And then last but not least, analysis of the potential ECI programs. And then at the end, we gave evidence-based recommendations. I have to say that our recommendations were very similar to yours. I guess that we are very similar in spirit and in ECI as well. Okay, so you see I put a lot of animation on my PowerPoint because I'm a special educator and this is the last presentation, so that's why it's maybe, it's more animated. So number of centers, ECI centers in Macedonia, as I mentioned, is 55. From those centers, 33 are located in the capital of Skopje. That means that people that are from other remote areas, or as I said, rural areas, do not have access to ECI. We will see at the end who pays for this ECI. Then 20 of them were state centers. As I said, small parts of larger clinics or hospitals, and 35 was the number of private centers. And then this is the point where, together with Emily, we made the executive decision that we should include private centers as well, so that we have an overview of the entire picture for ECI. If we only included state-funded centers, we wouldn't know the real picture of ECI in Macedonia, the real condition and situation. From these 44 directors that replied to our questionnaires, 14 were private companies, 16 were NGOs, and 11 were public health institutions. Again, I have to say that the state-funded ECI directors did not cooperate because of lack of information. They had the questionnaires, they went through them, we had several meetings. Unfortunately, they did not have the data that we needed. And I have to say that the questionnaires were quite large, maybe an hour. It took an hour to fill them in, but at the end it was worth a while. Okay, so regarding eligibility for ECI services, you know, it's a very known fact that 10 to 15% of children from birth to 6 have some types of developmental delays. Fortunately, in 2022, after 20 years in Macedonia, we conducted a census, and that census said that the number of children from birth to 6 is around 140,000. Currently, 10,000 children and 175 receive ECI services. So we have a number of 7,379 children that are in need of additional ECI services. I don't know if you remember the presentation from Georgia. I think that they were providing services to around 2,000 children per year. You can see how large the discrepancy is and how many children in need for ECI there is in Macedonia. I don't know why this has changed on the presentation, but I guess you can read it. Okay, so regarding populations that are receiving ECI services, Ida mentioned that that's the number of children. 49% was the number of children that received services below the age of 3. In Macedonia, the average age for onset of ECI services is from 25 to 36 months. That's predominant. So 36% of all cases were from the age of, so children were from the age of 2 until the age of 3. But that's not the most worrying part. The most worrying part is that 31% below, where you can see that 31% are older than 3 years. Is it ECI really, or is it just intervention after 3 years? The biggest part, 42%, of course, were children with developmental delays. We had children born at risk, children with behavior, emotional difficulties, with disabilities, mental health issues, and so on. And the age of children, very near to the Montenegrin percentage, they had 49%, and in Macedonia, the age of children that currently receive ECI services from birth to 3 is 44%. Again, the more worrying number is the 31% of children that are from the age of 5 till the age of 6. Again, is that ECI. Regarding populations receiving ECI services, 83% come from urban areas. And Macedonia is a very, I would say, an agricultural country. We do have people that live in rural areas. You can see that children are, only 70% of children from rural areas receive ECI services. 80% are Macedonians, only 13% are from the Albanian ethnicity, 3% are Roma, and 4% are other. We have municipalities and we have cities in Macedonia. We are a multi-ethnic country, and we have some cities where the percentage of population of the Albanian population is more than 20. So you can see here that with this slide that we, also the Albanian ethnicity or children from Albanian ethnicity are underserved. And then 64% of the parents had average income. Regarding location for provision of ECI services, 81% or 33 centers provide services only in the center or hospital. This is this traditional model or legacy ECI programs. 19% or 8 centers provide services in the center with occasional home visits. They do go to the homes, provide some of the services, but not all. And 0% provided contemporary services or completely family-oriented ECI services. What is a beacon of hope, I would say, are these 19%, and we see them as a transition towards contemporary ECI programs. Regarding the types of ECI services, there is only one center that was opened by UNICEF, and that provides, let's say, contemporary ECI services, but only from birth to 3. After the age of 3, the services are still very child-oriented. Then 11%, only 11% of the centers provide only ECI services. This means that in 89% of the cases, we have, again, larger education, special education centers that provide services not just for early intervention, but for all types of disabilities and for all ages. So what can we say? We have still in Macedonia child-centered services. We have lack of IFSPs. We have lack of parent education. Unfortunately, we have a lack of transition plans, because when you finish with ECI centers, you need to go to preschool inclusive settings or inclusive schools and so on. And all of this points to the low use of contemporary ECI services. So the contemporary ECI programs believe or say that the eligibility should be determined within the ECI centers. In Macedonia, we have one so-called ICF center that currently provides comprehensive assessments, and that defines which services a child should have. But in contemporary models, the assessment should be done in the ECI center. This is something very difficult to convey, and this is this paradigm shift that we're talking about all the time. Regarding recommendations, there are a larger percentage of recommendations, of course, came from the parents. And regarding eligibility, most of the centers do take into consideration a diagnosis, if that's something official, but all of them, they also take into consideration the at-risk status, but all of them conduct comprehensive assessments. I have to say that all of these ECI centers, of course, though they are different types of assessments, but they're very comprehensive, or it's trying to be. Regarding screening, assessment, and teams, 39% of the parents participated in the screenings. 56% of the centers use screening instruments, and 22% of the centers used ASQ. We are currently working on a project, the Faculty of Philosophy, together with universities from Spain and Cyprus, and Učilnica Daskalovski from Macedonia. Those are 3 partners, together with us 4 partners. We're currently working on something which is an Erasmus Plus project, which is called Updating University Curricula in Early Childhood Intervention. I will share a little bit more information about that later, but for now, I just wanted to say that we developed a screening manual, I would call it, for ECI. And of course, it's largely based, as in all other countries, on the ASQ3. So I think that this will be a very good instrument for screening in the ECI centers in the future. Regarding receiving developmental assessments, 76% of the parents received such assessments, but none of the parents signed an IFSP. And this really points toward child-centered services. Parents were not even introduced to the concept of IFSP. In a little bit of background, in Macedonia, we have a very inclusive education. We don't have, I guess it's a similar situation, we do not have special schools anymore. They have transformed into resource centers. So a lot of our practitioners and parents do know what an individual education plan is, and they sign it, they work on it, and so on. But unfortunately, when we're talking about ECI, they didn't sign, or they never even heard about an IFSP. Regarding teams, and this was very sad for me, because I really believe in transdisciplinary, family-oriented ECI. Only 6% of the teams were transdisciplinary, and we can see that the largest majority, 64%, were interdisciplinary teams. Regarding staff, professional development, and quality assurance, 90% of the centers do not hire paraprofessionals. Paraprofessionals is something which is I don't know how the situation is in Montenegro, but in Macedonia, it was very difficult for our centers to hire somebody that's not been educated enough to work in ECI. And the largest majority, of course, of professionals are speech therapists and special educators. Regarding education, our ECI professionals can receive their education at the University of Skopje, where I work, or University in Tetovo in Albanian language. And with this project that I mentioned before, and this is news, I haven't even managed to share it with Emily yet, but we are currently working on developing a master studies for early childhood intervention, and it will be very family oriented, and we will start next year. And I hope that next time when we see each other, that at least that will be done. It's very easy for us from when we are from academia to do these things, and then it's more difficult to do the practical things like in Montenegro. But of course, that leaves a very large gap for professionals, ECI professionals that work in service. So what to do about them, how to train them, and so on. Regarding professional development, the most desired training, of course, was professional workshops and one-on-one trainings. Then regarding quality assurance, 30% of staff satisfies some standards for licensing, and 90% go through files weekly. That's files, not filed. And what was very devastating, we do not have certified ECI programs. 49% of the centers do have some salary scales, some have career ladders, but that's not real contemporary. And then supervision, 41% of the centers are supervised, but the supervision is done by the ECI directors themselves. It's not external, it's internal supervision. Regarding ECI programs, networking, and intersectoral coordination, so we have no official ECI procedures or standards. We have no external monitoring. 39 have internal monitoring. We have no coalition or network of ECI providers. And we do have cooperation between ECI centers and clinical centers or kindergartens and schools, but that's not official networking and official cooperation. Regarding the cost-benefit analysis, this was a very large portion of our research, and Natalia really helped us, Kakabadze, with the cost-benefit analysis. And the report is also 150, I forgot to mention that, 150 pages long, from which 50 pages are annexes and 100 pages is raw text. It's font 10 and it's single spacing. So you can imagine how much data we have. But just very briefly, what's happening in Macedonia. In 93% of the cases, parents pay for ECI services. And this was also very devastating. Who has money and who is from Skopje will probably receive services. Children from rural areas, from minorities are very underserved. But these children are going to go to school because we have compulsory primary education and compulsory secondary education. So the government, the country will pay for their inclusive services for inclusion, for educational assistance, and so on. Why not invest in the first 3 or 6 years? Why invest in living with support, working with support, and so on? The cost-benefit analysis also found that we can look for money or ask for money from the Ministry of Labor, Ministry of Health through the Insurance Fund, Ministry of Education through resource centers, or from the municipalities. Even municipalities have some program funds that we can use to support ECI. They do support some disability programs, but we can use them to support this as well. I will go very briefly through the recommendations because they were very, very similar to Montenegro. At first, we need an ECI strategy and action plan. So sometimes when we talk to our UNICEF representatives, they say if you do a strategy, then it will end up in your drawer, and it's not something that is worth doing. But I firmly believe, and we've discussed this with Emily many times, that we do need a paper, we do need a strategy, and we do need an action plan that and that will be a piece of paper, a document which will lead us in the following years. We need advocacy efforts for ECI. In the morning, one of the keynote speakers mentioned Heckman. He is a Nobel Prize winner that has done a lot of cost-benefit analysis. And what he has discovered is the following. So if you take something home from today, from my presentation, take this. If you invest $1 in inclusive education, you get $3 back. If you invest $1 in preschool inclusive education, you get around $6 back. But if you invest $1 In ECI, you get $9.2 back. So of course, all of us are very humanitarian. We do this for the children and the families. But even if we see this from a financial perspective, then this is the best way for advocacy and lobbying and so on. We need ECI standards and procedures, personnel training, and some of that has been done in the past months, and I will share that in a bit. Of course, we need a national database. We need supervision. It will be of ECI. It would be wonderful if that is reflective supervision. We need a universal system. And of course, we need pilot sites as in Montenegro. All of this should be done through phased investments. And so just very briefly, I don't know if maybe I passed the time or I'm okay with my time. I don't see many board faces. 1 minute. Okay, I will pass. So after the situational analysis was done and we had a defense of the study before stakeholders, UNICEF has done some next steps. Unfortunately, I wasn't that much included. They consulted me in 1 or 2 meetings, but they did do several steps regarding ECI. The first one is a UN-funded project by the UN PRDP, and the project name is Keep from Knowledge and something on E to Empowerment and Participation. That's the acronym of the project. I can't remember what the first E stood for, but the idea of this UN project was to create a policy proposal. This has been this is an ongoing project from UNICEF. They're working with the Ministry of Labor, Ministry of Education, Ministry of Labor and Social Services, and Ministry of Education, Ministry of Health, of course. And they, together with civil society organizations, NGOs, persons with disabilities, and so on, and they are working on this policy proposal. The final goal is to create, to organize, and to embed system services for ECI that should be, of course, family-centered, family-oriented. And these are the phases that they have gone through until now. First, they've done an analysis. Of course, they piggybacked on our analysis, but they conducted additional analysis for embedding services for ECI. Where in the system we put ECI? Should it be in the health sector, in the education sector, and so on? This is an ongoing activity. This has been happening the past 2 months, I think, 3 months. Of course, as I mentioned, it's with close collaboration of ministries, and they are working on conducting ECI standards and procedures, and ECI standards, for staff and for how to conduct ECI in Macedonia. It's a very, as I understood, very small grant, but it's a step forward towards family-centered ECI. Then phase 3 were 2 5-day trainings, and we discussed about the trainings. These are trainings for capacity development, of course. They have finished with these trainings. 50 people from daycare centers, from kindergartens, and from ECI centers have been trained. The trainings, as I understood, were more disability-oriented than family-oriented. So I really hope that in the future in Macedonia, we will find enough funds to have family-oriented as they're supposed to be training. So transdisciplinary, routines-based, and so on. And the next step that will happen in the following months is, of course, mentor support for ECI professionals. So they will monitor the work of these people, of these persons that were educated, and then they will offer some mentor support in the future. And here I would conclude it. Thank you. Thank you very much.
Thank you a lot, Aleksandra. I think with these 2 presentations, we really demonstrated how the ECI situational analysis is the first step. And then it really helps to see what is the status of the existing services and then plan forward. And some of the tasks and the recommendations maybe take years before they can be really addressed. And also system building is a long-term process. It's never ends. You always learn new things and develop the services and the system. So we have 10 minutes, and if you have some questions to Aleksandra and to the situational analysis in North Macedonia, because it's really interesting. I mean, what they found in the country, but it also shows how it's used for a further development of the services and the system.
It's more a comment than it is a question, but first of all, I'd like to congratulate both of you on what you have achieved, not only during the research, but after the research. I am blown away as I sit here, just overwhelmed to hear about the advancements that you're making in the progress forward. So congratulations. The second thing is you have two very strong baseline studies. You can recall to people the results of what you found in year one, which is the baseline. And you can say, we have made the following advancements. We have achieved this by year two. By year three, we have done yet more. And then by year five, you've got a book that tells the story of how you developed your systems in 5 years. So I think the question to you would be, what more could you do in inspiring others to work collaboratively with you to bring about the fulfillment of the recommendations in your studies?
What more can we, was it a question or a comment? Well, hopefully to get, yeah, sorry? Yeah.
What more do you have in your minds about things you would like to do? If the resources were there, what would you like to do to achieve the goals that I know you have for your country?
Yeah, so if we were presidents of the country for one day, what would we do? Yes. Well, first of all, as I mentioned, I would definitely do family-oriented, but real family-oriented trainings where the transdisciplinary model will be discussed, how to work in teams and so on. Because as I mentioned, we did have trainings, but from what I found, they were very, how to work with a child with autism or how to work with a child with cerebral palsy, and that's very medically oriented. We want to move away from that model, not to, again, piggyback on it and do it for the next couple of years. If I had the power, I would invent a ministry which will be a combination of health and social services and education. Of course, that's impossible. But as it was mentioned in the national situational analysis, I would love to see ECI under the Ministry of Health from birth to 3, and then from 3 to 5 under the Ministry of Labor and Social Policy, because they are responsible for the kindergartens, and then from the age of 5 to 6, to Ministry of Education and resource centers that can provide services as well. This is very difficult. Even when I say it, it sounds impossible, but I think that in Macedonia, that's the only way to go. So cross-sectoral cooperation and so on. I would also, the next step would be to create, I would say, a network of enthusiasts that would lobby and raise awareness and so on. And we've talked about this so many times. Unfortunately, the past months, somehow, not that we didn't have communication, but I haven't been that much involved in these processes that UNICEF has done. But that's something that I think definitely should happen, like it is in Georgia. I saw wonderful things from Georgia in this morning presentation. And I would also, one of the things that I think should be done in Macedonia is that we should take take use of or use the private centers in a way, the NGOs, some of the NGOs, of course, not all. Of course, we need to fix all of that licensing and so on, but I do believe that we have wonderful private centers that can provide ECI services. So basically, that's what I would do. And yeah, I can't think of anything else.
Well, in Montenegro, we have elections on Sunday. I think the first step for us will be to make sure that the new government continues. And this is why it's important for this ECD strategy to be adopted, because as I said, it's not an ECI strategy, but it has really, it has a vision in it and it has some measures. And I think it's a good place to start. And once it's adopted, I'll feel much better because, the new government will have to, I have never seen a government annul a strategy. So I think I hope this will happen and we can ensure continuity. And one priority for us will also be to communicate on this with parents. And we have a situation in Montenegro now that the parents associations that we used to work with for the past 15 years or so are membership organizations, and their children, you know, have sort of aged out, and we need to work and involve these parents of younger children now. And we need to also work with them, because this, as Snežana said in the panel, it's a change in paradigm for policymakers, for practitioners, and for parents as well. So very important to have them on board and to understand how much they can do as parents with their children. And Emily had this wonderful slide, how much time they spend with children and how much a therapist can spend with children, and how much power parents have. And they don't realize it sometimes. So I would say that we need to start to communicate. And this is also something, a task for me to communicate on this in public, on the pilot that we have in these 2 municipalities, and to start really at all levels and all stakeholders, and parents are the stars, as your early aid says. So we have to work with them. That's a priority, I think.
Thank you. If there are other questions?